All right, so walk us through where we are, what's going to happen here.
So we're at the Christenberry Field House, which is on Wrightsboro Road, and we are standing up a drive-up testing center for COVID-19 that is by appointment only. It is for people that have downloaded the app and done a screening online with one of our physicians or APPs and has been determined to be at high risk for COVID-19 or a person that we would want to test. And so we will schedule those those persons a time to come by and a scheduled timing when they will drive up, and that way we don't have to send them to an emergency department or something like that to get tested. They can come out here to get tested, and it will offload the emergency department.
So when they get into the app, what kinds of questions are they going to be asked? What is the screening process like before they arrive here?
So when they go into the app will allow them to fill in all of their information and answer some key questions about their risk posed by their exposure to COVID-19 or their travel history, as well as medical information that might put them at higher risk. Once they answer those questions, then they will see a list of providers that will be available, and as they go through and select the providers and answer those questions, then the provider will come online and actually see them live on the video, and they will interact and ask questions about their risk to further clarify that and determine if they need testing or not.
And then when they come here, what should they expect here?
Yeah, so
at station number 1, there will be a nurse, and the nurse will actually verify that they are scheduled to arrive. If they're not scheduled, we'll provide them some information on how to go do the virtual screening, and then we'll encourage, if their result is positive, that they'll be scheduled and come back. The nurse will verify that they're scheduled, and then we will actually provide them some education on COVID-19 and how to self-quarantine and review some of the literature around how to take care of themselves as well as their families. And then they will proceed on to the station where the test is actually performed. And then the swab will be taken, and then they'll be able to leave and go back to their home.
And how does this assist with testing capabilities? Can you talk about the numbers you guys can perform every day?
Sure. So we are aggressively trying to increase our testing capability. As we've said previously, we are very fortunate here in Augusta that Augusta University and the Medical College of Georgia does have some advanced lab testing capability that is still limited. So the fact that we're able to perform the test is unique and something we're very fortunate about. We can't test everyone, so we are still limited. And of course, there are other factors that play into who we should test. But we can run tests locally, particularly for those that are higher risk. We can test and run those locally. For others, we may still be sending out to reference labs that have a little bit more robust testing capability, but those results will be slower coming back.
How limited? Can you say dozens or hundreds on the day-to-day?
Yeah, so the number of testing kits is still a limitation, and there are other factors that play into it, but we can run about 6 every couple of hours in terms of in our lab if the supply holds out of the testing materials.
So you guys had talked about, I think it was yesterday morning or 2 mornings ago, just what sets Augusta University apart that allows you guys to do those kind of testing. We've had some questions about kind of specifics on that. How is that possible? Could you elaborate a little bit more on that? Because we hear about lack of testing across the country. What is it specifically that allows us to be a little bit above?
Sure. So again, as an academic medical center, we're very fortunate that we have some of the world's experts in some of this type of testing. And our genomics and esoteric molecular testing lab, or what we call the GEM lab, is a group of experts that essentially specialize in doing unique testing. And we do that for cancer, we do that for some other modalities. We simply had them refocus, and actually at their own initiative they refocused on this effort. And I can't say enough about Dr. Colhay and his team, as well as Dr. Allison McMullen, Dr. Brandy Gonzalez, our entire microbiology team, and all of our lab staff and personnel who've been working around the clock to develop this technology and to be able to do that.
When people come here, Is there ever a point that you guys decide that they need to be hospitalized because of their symptoms?
So we don't anticipate that because of our screening technology that we're using. One of the reasons we're using video technology is because it allows us to be more sensitive. So I can pick up on clues when I'm evaluating a patient via telemedicine that you might miss on a chat or an email or just a telephone call. So we think that we're pretty confident about the ability to pick up on, for example, patients that may be in more distress, and we would divert those patients immediately when we evaluate them. In the event that someone shows up, we have healthcare professionals on site that can get the patient to the right place at the right time.
And then the people here who are administering the tests, what precautions are you guys taking to make sure that they are protected?
Sure, so we're following the CDC guidelines. The fact that we have people doing screening while the patient is in their car or the person being tested is in their car is an advantage because that keeps them away from everyone else. The car essentially provides some isolation, okay? So our personnel will be in proper personal protective equipment as recommended by the CDC to perform the test.
Where's the money coming from to do this?
So Augusta University is underwriting this effort right now, but we're hopeful that the state will support us in this effort as it is vital to the citizens of Georgia. We believe in supporting the community and supporting the state, and we're just trying to do the right thing for our patients, and that's what we're trying to do right now. We're hopeful that the funding will come through for it.
Any idea how long you guys will be out here doing this? Is there an end in sight?
Really, as long as the community needs us. We're prepared to scale our situation as necessary to support the citizens of this area.
And is this particular site a trial run for more to come? Will we see more popping up across Augusta?
It's hard to predict the future, but I think we've got enough scalability here that we're good for quite a while. We have actually been doing drive-up testing out of our emergency department, which the initial positives that resulted in this case were drive-up testing. So we've got a lot of the kinks worked out, knew what some of the issues were then, and this is just a scaling of that. But one of the reasons we chose this location is because it does have a lot of room. It's an excellent asset to use, and it allows us to leverage this and scale it as necessary.
If I'm typically a doctor's patient, a university hospital patient, can I still come here?
We will see those patients. Again, we ask that you go online, get the screening done so that we have an awareness of that. But we are taking care of the community. We're taking care of patients. We put our patients first. That's what we believe in, and we will take care of anyone.
Do you have any idea of how long it takes to kind of go through the whole drive-through process?
Depending on whether or not there's a line, it should be about a 5-minute process from the time that you check in with the first station to the time that the test is completed.
Do you want to comment on why that is, that we're doing a lot of work in advance?
We are, and that's part of why we're requiring scheduling, so that we make sure that we have the patient labels and we have everything provided in advance, so that once the patient arrives, it's a very quick process. We provide some education and then we move on to doing the test and getting the specimen collected and processed.
So scheduled patients only, how many are you anticipating to see today?
As of about an hour ago, we had roughly 20 scheduled. And that is actually changing real time as additional positive screenings come through that we need to schedule. And we're scheduling real time actually right here.
And what is actually in there? Yesterday when we saw people setting up, they were bringing things in there. So what's in there?
The registration staff. So whenever there are positive screenings, the registrations that the providers deem positive, we have a full registration team inside there that's actually contacting the patients, getting their information, and scheduling them to come on site.